as Roth Riley or Dr. Riley. Some people just call me Doc. Um, I got into medicine because what I really wanted to do was help people. And I've been practicing medicine now over 25 years. And originally, in my training, I was originally trained to examine people, make a diagnosis, but the end of every interaction always ended up with me writing them out a prescription. And in the end, that was really no real way to get people healthy. Not until I found or went back to school to study anti-aging medicine did I really find out really how to help people become healthy. And so now we have many techniques that we offer to actually get people healthy without the additional use of pharmaceutical medications and or surgery. Essentially, stem cells are the master cells. Those are the cells that are used to grow and develop really a total human being. At this point, what we use is something called umbilical cord stem cells. We got our umbilical cord stem cells from mothers who donate their umbilical cords to science. They're sent off to a lab similar to what you might think of when you get blood drawn for the Red Cross. They send off to the lab where it's screened. And then we are able to use these to help regrow and regenerate tissue. Mostly we restrict our stem cell use to help regrow and regenerate tissue in the knees, elbows, disc, multiple different places where we use our stem cells to help regrow and regenerate tissue. That's a very good question. We know that stem cells are expensive. So we've done everything that we have to do in our power to keep our stem cells at a place where people can afford them. Typically, a person will spend about $6,500 to grow and regenerate a joint. We know that's still a lot of money for a lot of people, so we have put together a financing package where a person might only need to spend maybe $200 to $300 a month for stem cells over a period of time. No, unfortunately, that's one of the things that aren't covered by insurance these days. And we don't know exactly when it's going to be covered, but a lot of things really aren't covered by insurance. Everything from dentures to hearing aids to LASIK surgery are not covered by insurance. But this is just one of those things that we know that people are going to experience a lot of benefit from them, relieve them from pain, provide them with better function. So it's one of those things that aren't covered, but we think it's well worth their personal investment and cost. Um, it's going to take a while for stem cells to work to notice a real difference. Typically, what happens is that a person will get the stem cells on a Monday, and they'll feel absolutely no change, no different for the first week or so, first 1 or 2 weeks. Then slowly and gradually, as the tissue is regenerated, you begin to feel a subtle difference. What I've had the experience of happening with several of my people is for example, this will happen with them. During week 3 or week 4, the doorbell will ring. They'll jump up, go answer the door, and as soon as they get to the door, they'll notice that they jumped up and went to the door and didn't experience the same level of pain or discomfort that they've had previously doing that same type of activity. And from there, it's a constant growth of tissue, constant growth of a healthier tissue, and less in pain and more function over a 6-month period of time. Stem cells are not FDA approved. It's not really, doesn't really come under the auspices of the FDA, but they are screened. They are, done everything that you would do to screen for a blood transfusion. So all of the, communicable diseases are detected. If there are something like that, then they aren't used, but they're relatively safe. They've been being used for the last 30 years or so. And we have full confidence that we can do, the work that a stem cell does. stem cell therapy is not for everybody. That's one of the reasons why we actually screen each and every individual person to see if they're actually a candidate for stem cells. Like I said, not every cure is for everybody. We know that with our patient population, if we can select the right patient, we can usually get an 80 to 90% improvement in functional improvement. Absolutely not. Nothing in medicine or anything really has a 100% guarantee. But I always tell people just to think of the benefit that you'll gain if you're one of those 80 to 90% of the people who come in who might have some form of disability, ache or pain or dysfunction, and you're able to resume your normal activities or what used to be normal activities without the pain or without the dysfunction. But no, there's no guarantee to this. I get excited about stem cells because at this point in my medical career, I can actually give people the benefit of using something that's actually going to heal a problem and not just mask or cover up a pain symptom and slow down or regenerate a tissue as opposed to taking a pill and having the degenerative process continue and ultimately end up needing surgery.